Hello everyone, how are you all doing today? Happy October. It is PT month, and this vlog discussion we are talking about physical therapy. What is it anyway? I'm Dr. Janae Brown. To my right is
Dr. D or Dr. Daisuke.
we have
Dr. Sandoval.
and
Kristen.
all here, and we are going to talk to you guys about physical therapy. What is it? You might know people or know someone who has done physical therapy and kind of been like, what is that? And we're going to just talk about it with you so you guys can have an idea of what we do, as fine clinicians do. So, what is physical therapy? A lot of our patients, a lot of people think that physical therapy could be a chore, something that is not actually something fun. If you know somebody's done physical therapy, you might not be envious of them because they're like, oh, I have to go to physical therapy today. Doesn't sound all that exciting. But honestly, for us in our center here, physical therapy is something that our patients really love. And it's oftentimes hard for us to get rid of our patients and discharge them because we sort of become their person. So guys, why do you guys think that our patients, not nobody else's, just only ours, don't ever want to enjoy physical therapy and like want to stay? Anybody? What are some reasons why they might want to not be discharged?
I think just because when we first started out with just the evaluation process and stuff, we think primarily about building the relationship first. So rapport building is obviously one of the more important things that we have to start off with. Is obviously if they don't want to come back and see us, then PT is not going to work very well anyways, right? We can't educate them anything beyond that starting point. So we just basically become friends by the end of physical therapy or during the process of physical therapy, and just makes things a lot easier too for them to absorb things as far as education and knowledge, and especially towards the tail end of it, it gets cool because we're movement experts and we do a lot of strength training really based off of what our gym looks like. They want to continue to build on where we left off. So they just want to get better and better, and it's kind of difficult for them to leave and become independent, but that's always our end goal. Independence is going to be very important towards the tail end. So.
Introduce us to your friend. Who's this guy?
Who is this guy?
Do you guys know his name?
LeBone James.
LeBone James.
LeBone James.
He's hanging out with us today in honor of, October, Halloween.
Yeah.
Guys wanted to.
He's my friend.
He's Dr. Sandoval's friend.
He's my
Kristen,
friend.
what are some reasons that you feel like our patients don't want to be discharged? Why do you think they like physical therapy?
I mean, I agree with that, with what Dr. D said. I think they feel very much listened to and cared for, therefore special, and it just makes it, when you see the results and you feel the results, and it makes it fun to come back to kind of see like what you can do next session. So I just agree.
I think one of the things that we like to focus on is we tailor what we do here to that specific individual too. So those relationships, that's the foundation of what we do, but then we also make sure that we do things based off of what that individual needs in order for them to return to whatever it is that they need to do. Right? And so there are a lot of places out there that just give out basic exercise programs. We don't do that here. We really tailor things to what they need.
Yeah, for sure. So we become your person, we help you get rid of your pain. We get you back to doing things you love to do, sports, recreational activities. And then we teach you how to move and exercise well, and then kind of become your personal trainer. And so I don't know anybody who doesn't I want my own personal trainer where I show up and I just do what they tell me to do and I get to leave and I feel great. So that's basically what ends up happening with our patients by the time they leave. So it's like, well, why do I have to go? This is so good. This feels great.
Also, just things that they didn't know that they
That's
could
true.
do. It's just so
True.
exciting for all around for everybody.
Yeah, because we often exceed our patients' goals, right? We get them doing things that they above and beyond what they could do. So that's true. That's a good point, Kristen. So We know why our patients like to stay. And we just want to share that with you guys because physical therapy can be a great experience. It can be a learning tool. You can learn things about your body that you didn't know. You can fix things that you didn't come in for. Maybe you came in for a knee injury, but really you're doing something wrong when you squat or when you deadlift or when you anything. It could be a lot of things that you could learn. So you learn a lot in the process as well. So that's why it's also a cool thing. So back in the day, physical therapy was very, very modality based and very much like hands-on based. So when I came out of PT school, exercise was definitely a part of what we did. We developed exercise programs, and that's what makes us made us different than any other sort of pain specialist, is that exercise has always been a part of our treatment protocol. But we also relied really heavily on modalities in the beginning of therapy, and when it first came out, it was really just massage, ultrasound, electrical stimulation, ice, heat, right? Like there's some other ones that I never even saw in clinic when I was out, but there's been a history of modalities that have come out to sort of help people. So, and current day physical therapy is changed a lot, and a lot of that has to do with research, right? So research has shown us a lot of stuff. So, Dr. D, talk to us about how's current day physical therapy a little bit different than physical therapy in the past?
Yeah, so like Dr. Brown was saying, research-based as far as the evidence goes now, we comparing, the strength training, stretching, mobility work, all the modalities that have been out. Based off of all the different types of interventions, we now know that exercise is actually one of the most beneficial interventions that we can use for orthopedic and neuromuscular types of injuries. So that's pretty much what we base everything out of. But we can still use manual therapy and manual resisted exercises and stuff like that, just to either prep up that particular patient or that client, just so that we can create open a window so that we can move a little bit better during the entire session. So currently the combination of utilizing manual therapy and exercise has been much more effective than everything that's been out in, over the last 40, 50 years or so.
Yep.
So everything is trending more in that direction. There are still some clinics that still heavily rely on modalities, unfortunately. It is what it is. But research is continuing to spit out more of this information about the benefits of exercise. So hopefully people get on board with it a little bit more. Using modalities is obviously easier, but it doesn't really get the results that we want to get out of from our perspective and the patient's perspective. So things are trending, but we still have a lot of work to do.
That's right. And we're learning a lot more. I think we have to be careful. I've seen waves of PT going different ways, and we can probably talk about this all day, but basically, we have a lot of tools, and it's the big long-term goal is get you moving, get you back to doing what you're doing. So that involves movement, exercise, but we can utilize those things like Dr. D said to get us there, and that's really the big goal, is not to stay there, not to stay in that area where you're trying to reduce pain. And we used to think that modalities were the reason that pain went away. Now we know you can reduce pain through exercise, which has changed things a lot. So the more we know research-wise, the more we understand conditions and diagnoses with research, that has given us sort of this methodology for treating this way. So, yeah.
Medicine changes
For sure.
every year. Even during the year, things change. Trends always come up, and research comes up. And one year they say this is good, next year they say it's not. So I think part of our job is just making sure that we're staying consistent with the evidence itself is very important.
For sure. And using your experience. Experience is everything as well. And some things are hard to, research is great, but some things are hard to prove on paper. Patients are complex. People are complex. So we have to be smart and use our common sense as well. Dr. Sandoval, what can a patient expect when they first come in the door? A client expect if they're injured and they're coming in for their first session with you, what would they expect? Are they gonna come in and start exercising that first day and jogging and running? What are they gonna do when they walk in the door? Are they gonna do nothing that day and just kind of get massaged and
Absolutely.
Okay. What can they expect?
No, they can expect probably a little bit of exercise towards the end of that initial evaluation. First and foremost, we're gonna have a conversation about what it is that they're feeling,
Yep.
how they got injured in the first place, what their goals are at the end of PT. That way we can create a plan, create an effective plan to get them back to what it is that they need to do, right?
Yeah.
We're gonna do an assessment of how they move and figure out why they got injured in the first place.
Okay.
And, like I said, develop a plan of different exercises or things that they can do, behavioral modifications, things that they can do to allow them to recover from this injury, right? And so then with that, in that evaluation, we can potentially look at exercises that they can do here, and then also give them things to do at home. So that's kind of a gist of what they should expect.
Cool. Big
per se.
picture. Awesome. And so they'll get some things to go home with that they'll work on.
Yeah.
And then when would you, what's the typical amount of times you would want to see a patient? Does it vary for every patient?
I think it varies. Typically, orthopedic injuries, I would probably say once or twice a week, maybe 3 times for a couple of weeks. Let's say 8 weeks, but it really just depends on what that individual has going on.
Yeah, and the injury, right? So
Yeah.
we're always kind of guesstimating what, based on the injury, the length of time we would need to see a patient, but it's, unfortunate, I'm not unfortunate, but I guess unfortunately, sometimes you want to know how long am I going to be in PT, but really injuries don't go that way. Everybody heals a little different, time is different, what you have to do is different. So we try to give you guys a guesstimation of how long we think you're going to need it, but you're not going to be in it all year and for the rest of your life. I guess that's the big thing, is the goal is to get you, feeling better and back to the things you need to do. Kristen, talk us through a follow-up session. Dr. Sandoval sees that patient for that initial session, determines what the problem is, creates a plan, gets them started on some home stuff. They come back for their follow-up session. What would you do with them?
So for their follow-up, first of all, just make sure that the evaluation went well and they, felt okay following the evaluation. And then same thing with their home exercise program. Make sure that those were all feeling good at home. Check in if they did them, and just reiterate the importance if they didn't from the get-go, get that established. And then just assess how it's looking, how their exercises are looking, and any progressions that are applicable that day, and just kind of setting the stage for what their follow-ups will look like following their first follow-up, so they know what to expect progression-wise. And
Yeah, perfect. I think the big thing that is important for PT is education, and that we're talking with you guys about what's going on, why you're having this problem. If you come back from a session that you just had and you feel a little worse or something changed, really trying to figure out what you're doing at home. You're at home and in your life and in your sports and in all that stuff more than you are here. You're here 2 to 3 hours a week. So we make education a big focus for our clients, because that, I think, is a huge piece in order to get you to where you need to go. So, and PT is different for everyone, right? So not every patient follows the same formula. We make it individualized depending on your age, your height, your weight, your health history, your sports, your recreation, your job. Like, every person is going to should have a different treatment plan and protocol, essentially. And that is the key. If you're going to a place where it's cookie cutter and you're getting the same exercise every time, head to the door and find somewhere else, because your PT should be asking you a lot of questions, talking to you about how things are between sessions, changing your program, changing everything. And so, yeah. Anything else that you guys want to end on? We're huge advocates for PT, right? But not all PT is equal. Yeah. But anything else you guys want to leave them with?
I think the important thing is just giving them hope,
Yeah.
right? Just making sure that they have hope to recover from whatever they're going through, or whatever their goals are. Just making sure that we have some tangible, achievable goals at the end of the initial evaluation or each session that we go through, so that they feel like they're progressing as well. Like, they have hope that, with each session they're going to get closer towards that goal itself. So I think that's probably the more important part than anything else outside of education.
Absolutely, yeah. Our goal is to support you, get you better, get you on, and not be your PT forever, but be your PT forever. We're your person when you get injured, but get you out the door and back to the things you love to do. So I think that's it. Okay. All right. Well, you guys have a great rest of your weekday, and thank you for following us. Thank you for joining in. If you want any more information or want to see more of our blogs, you can follow physicaltherapysanpedro.com. We have a ton of great discussion blogs or things that we're talking about and sharing information about. You can follow us on Instagram at Physical Therapy San Pedro, and stay tuned for things that we're doing here. Bye, guys.